Last month, I operated on a 67-year-old man with colon cancer who couldn't afford his chemotherapy co-payments. Despite working his entire life, he was forced to choose between potentially life-saving treatment and paying his mortgage. This isn't happening in a developing nation. This is happening right here in Australia, one of the wealthiest countries in the world. I'm Dr. Tarik Sammour, a colorectal surgeon and associate professor at the University of Adelaide. As someone who operates within both the public and private healthcare systems, I witness daily how the gap between healthcare as a right versus a luxury is widening. And today, I want to take you inside this critical conversation that affects every single one of us. If you're concerned about accessing quality healthcare for yourself or your loved ones in the future, you're not alone. The sustainability of our healthcare systems is reaching a critical tipping point, and the decisions we make now will determine whether comprehensive care remains available to all citizens or becomes a privilege for the few. In this talk, I'll provide you with a surgeon's insider perspective on why healthcare costs are spiraling out of control, actionable frameworks for making better healthcare decisions, evidence-based solutions that could preserve universal access while ensuring sustainability, and I promise to share some medical insights that many healthcare professionals won't openly discuss with the public. Here's something that might surprise you. Extending human life expectancy from our current average of about 80 years to the biological limit of approximately 115 years would cost our healthcare system roughly 15 times what we currently spend. That's not 15% more, that's 15 times more. And what most doctors won't tell you is that we're rapidly approaching a point where we simply cannot afford to provide every possible treatment to every patient, regardless of benefit. Stay with me, because later I'll share 3 crucial questions every patient should ask before accepting any medical intervention that could save you from unnecessary procedures while potentially saving our healthcare system. Let me walk you through why healthcare affordability is reaching a crisis point in developed countries. As a colorectal surgeon, I see this playing out in 3 critical dimensions. First, our populations are aging rapidly. In Australia, the proportion of people over 65 is projected to increase from 15% to 23% by 2066. This demographic shift alone puts enormous pressure on healthcare resources. Second, medical technology continues to advance, offering new treatments that extend life, but often at exponential costs. A single dose of some new cancer medications can cost more than $10,000, with marginal benefits measured in weeks, not years. Third, our expectations as patients have changed dramatically. We now expect perfect outcomes and demand access to every possible intervention, regardless of cost-effectiveness. Michael was a 92-year-old man with rectal cancer who came to see me. The standard treatment would involve major surgery, potentially followed by chemotherapy and radiation. This approach would cost the healthcare system approximately $100,000 and would likely extend his life by 2-3 years at most. However, the treatment would require months of recovery, with significant impact on his quality of life. When I presented these facts to Michael, his response was surprising. "Doctor, I've lived a good life. I'm more interested in the quality of my remaining time than extending it through difficult treatments." This raises the fundamental question: should Michael have the right to every possible treatment regardless of cost, or is there a point where we need to make difficult choices about resource allocation? Now let's look at what the evidence tells us about different healthcare models around the world. When screen text, healthcare systems, the evidence. As a surgeon who has worked across multiple healthcare systems, I can tell you that neither purely public nor purely private systems offer perfect solutions. The data supports this observation. The United States spends approximately 17% of its GDP on healthcare, nearly double what Australia spends at 9.3%. Yet life expectancy in the US is actually lower than in Australia. This suggests that simply spending more doesn't necessarily yield better outcomes. What's particularly interesting is that Australia's hybrid model, balancing public and private elements, demonstrates better efficiency than either extreme. We achieve similar or better outcomes while spending less. But here's what's rarely discussed. Even our relatively efficient system is facing sustainability challenges. If current trends continue, healthcare spending could consume over 20% of our GDP by 2050, crowding out other essential services like education and infrastructure. Sarah, a 45-year-old mother of 3, was diagnosed with stage 3 colon cancer. In our public system, she received timely surgery and appropriate chemotherapy, with excellent outcomes and no out-of-pocket expenses. The same treatment in a purely private system could have cost her family over $150,000. However, Sarah waited 3 months for her initial colonoscopy in the public system, a delay that could have been avoided in the private system. This highlights both the strength and weaknesses of different approaches. Stay tuned, because in the next segment, I'll reveal 3 critical changes we need to make to preserve healthcare access for everyone, including a surprising perspective on end-of-life care that challenges conventional medical thinking. So what's the solution? I believe we need to fundamentally rethink our approach to healthcare delivery and decision-making. When screen text, the sustainability framework first. As medical professionals and patients, we need to care about cost. This isn't about rationing care, it's about eliminating waste and inefficiency. Let me give you a specific example from my own practice. For decades, surgeons have routinely used expensive wound dressings after simple surgical incisions. However, research now shows that most of these dressings provide no benefit over leaving the wound exposed. By eliminating this single unnecessary practice, we could save millions of dollars annually with no negative impact on patient outcomes. Second, we need to prioritize quality of life over quantity. This requires honest conversations between doctors and patients about the true impact of interventions. When I counsel patients like Michael, the 92-year-old with rectal cancer, I now discuss not just survival statistics, but also how treatment will affect their daily lives. Will they still be able to garden, play with their grandchildren, maintain their independence? These quality measures often matter more to patients than simply extending life. Third, we need transparent frameworks for resource allocation that balance individual needs with societal sustainability. Countries like New Zealand and the UK have established bodies that evaluate the cost-effectiveness of treatments before approving them for public funding. While imperfect, these approaches at least acknowledge the reality that resources are finite. Let me be clear. I'm not suggesting we abandon compassion or deny necessary care. I'm arguing that sustainable healthcare requires making thoughtful choices rather than pretending we can. Provide everything to everyone indefinitely. So what does this mean for you as an individual navigating the healthcare system? When screen text, 3 questions every patient should ask I recommend asking these 3 questions before any significant medical intervention. 1. What are the specific benefits I can expect from this treatment in terms of both survival and quality of life? 2. What are the potential harms, including side effects, recovery time, and impact on my independence? 3. Are there alternative approaches that might offer similar benefits with fewer risk or lower costs? These questions might seem simple, but they can transform your healthcare experience by ensuring treatments align with your personal values and goals. For healthcare professionals watching, I challenge you to have these difficult conversations with your patients. As a colorectal surgeon, I've found that patients appreciate honesty about the limitations and trade-offs of medical interventions. And for policymakers, we need to move beyond the simplistic debate of healthcare as either a right or a luxury. The real question is how we can make sustainable choices that preserve access to quality care for all citizens. The healthcare debate should shift from an all-or-nothing proposition to a nuanced discussion about making wise choices within constraints. This isn't about denying care. It's about ensuring our healthcare system remains viable for generations to come. To conclude, healthcare is neither an absolute right without limits nor merely a luxury for the privileged. It's a precious social good that requires thoughtful stewardship. The choices we make as individuals, medical professionals, and societies will determine whether quality health care remains accessible to all or becomes restricted to the few who can afford it. I believe we can preserve the core promise of universal health care by making smarter decisions, eliminating waste, and having honest conversations about what truly matters at the end of life. As patients, we need to be active participants in these decisions. As medical professionals, we need to consider not just what we can do, but what we should do. And as citizens, we need to engage in mature conversations about sustainability without resorting to political oversimplification. If you found this perspective valuable, please subscribe to my channel for weekly videos that explore the intersection of medical science, ethics, and healthcare policy. Together, we can work toward a healthcare system that balances compassion with sustainability, ensuring that quality care remains available to all who need it. Thank you for your attention, and I look forward to continuing this important conversation.